Hello and welcome to another installment with me, Alicia. According to a recent report, around 1 million couples worldwide undergo fertility treatments every year. Upfront, 1/3 of them are told that they have unexplained or idiopathic infertility, meaning doctors cannot seem to find anything wrong with either the male or female after analysis of sperm and fallopian tubes or uterus. On this video, we will discuss the facts surrounding the so-called unexplained infertility and approaches you can take that will hopefully overcome infertility. Much is still unknown about what it takes to achieve a successful pregnancy. In fact, for 1/3 couples who can get pregnant after years of trying, there is no apparent medical explanation. The majority of couples experiencing problems with fertility are able to receive an explanation for their infertility. These causes range from low sperm count, poor sperm motility in the man, to blocked fallopian tubes or endometriosis in the women. Once the causes for infertility have been established, the appropriate cause of assisted conception treatment can be undertaken. For almost 1/3 of couples, however, there has been no obvious cause for infertility, and these couples are given the diagnosis of unexplained fertility. This couple often invests a lot of time and money in fertility treatments, like intrauterine insemination, unlikely to be successful. But even when infertility has explainable cause, treating it is sometimes more art than science. Some women will do everything right and still get a heartbreaking diagnosis of unexplained infertility. Imagine this scenario. After months of trying to conceive without success, you and your partner decide to visit a reproductive endocrinologist for testing. After an initial workout for you both, they find nothing wrong. Initially, this seems like a good news, but as time goes by and you're still not pregnant, that good news begins to become more confusing and concerning. Of course, you don't want to hear that your husband has a low sperm count or that you don't ovulate on your own, but at least knowing that would allow you to formulate a concrete plan to address the issue. Instead, you're left with a diagnosis of unexplained infertility, which means that there is either nothing wrong with you medically, or we simply don't yet have the knowledge available to determine what is wrong. Statistics do show, however, that the more comprehensive your initial diagnosis workup is, the more likely they will be able to identify a specific contributing factors to your infertility. Unexplained infertility is a fairly common diagnosis, affecting roughly 20% of couples experiencing infertility. The important thing to remember if you receive this diagnosis, though, is that there is hope. If you still have a chance of conceiving naturally, it's critical at this point to ensure that both you and your partner are working hard at timing intercourse appropriately prior to and during ovulation. Fertility monitors or ovulation predictor kits are particularly helpful in this regard. In any case, a diagnosis of unexplained infertility is not the end of the world. It's important to remember that you're not alone. Great strides are being made in this area of research, and we expect that to result in fewer and fewer diagnoses of unexplained infertility. Thank you for joining us in our continued discussion of pregnancy and beyond. Don't forget to subscribe to my personal blog. Be sure to join us again in our future installment of About Getting Pregnant. This is Alicia signing off. Please leave a comment, rate my video, and don't forget to hit that subscribe button. Ciao!